I work with the end of the road kids. I find permanent families for teenagers in the system. And I'm really concerned if we use the argument about early intervention, if part of that argument is saying it's too late for older kids. I totally, Patty, hear what you're saying. I think I was hearing a different frame, to use your word. I was thinking about your kids and where they may have been had you guys not been around to help advocate in court and advocate for mental health services. And maybe from a parent's perspective, it's a disappointment. You have some ideas and visions about what you want. I believe that we can prepare families with appropriate expectations, and it's about lifelong commitment. Your kids have somebody who is committed unconditionally. I'm not talking about mushy love unconditionally. I'm talking about permanent commitment. And I will tell you, young people and adults will do way better in prison, in residential treatment, in CD treatment if somebody in the outs cares. And so I guess to hear you say that it's too late was just ripping I totally disagree with that it's too late. The other piece on the brain research, if there's anything you can do to extend the scans you show, stop at 14, all of the new research talks about adolescent brain development. At no time except the first 2 years of life is the brain more actively creating synapses and connections than during adolescence. It is a fabulous time to be. It doesn't mean you erase all that early trauma, but I think we're doing older kids a disservice, and it allows us to quit on them if we don't include them when we're talking about these numbers. Not that all this, it's all right on, but please don't forget the older kids.
I agree. It's never too late, and I will do everything, and the systems have done everything to support my older children. I think what I'm meaning more is I don't think it was fair to my children. I don't think it's fair to my oldest son that he wasn't taken out of a really bad situation until he was 8 years old. It wasn't fair. He is not living the life he would like to live. None of my kids are, and they're angry about it. They don't like that they have neurological deficiencies. They don't like being depressed. They don't like being angry. I won't give up on them, and I don't think the system will give up on them, but it isn't fair. And as far as brain testing, I've spent a lot of time at neurological psychologists going over and over my kids' development, brain development, and I find it extremely interesting because I've had them tested for 10 years in a row. Actually, sometimes they do improve. And I do agree with you. I don't think it's the end. But what's interesting is their brain development. Most people have kind of consistent brain development across the different levels. My kids go from superior to borderline impaired, and it's extremely frustrating for them because sometimes things are extremely easy. They learn quickly. Things come naturally. Other things are so hard. And I said to the doctor, I said, is this typical? He said, not at all. He said, every time I've seen one, it's a kid with a traumatic background. And so when I'm talking about it's too late, these kids should have been intervened a lot earlier. I think their families should have had help a lot earlier. I don't think their families are terrible people. I actually have met all their biological families. You know what? I like them. They're good people. They're nice people. But they had a lot of addiction issues. A lot of their parents were abusive. It's a cycle that has gone from generation to generation to generation. And our culture has to stop it. And I don't even know if there is enough money in the world to stop it. It's a cultural expectation. When you see a pregnant woman drink, you ought to have a problem with that because she is damaging that baby's brain, and yet I see it all the time. When you see a family member smoking, my youngest daughter has a lot of health problems because of her mother's choice in prenatal care. So, when I say it's too late, that child has to live with everything that happened to them. That's not fair. These kids need interaction and intervention a lot sooner. No, it doesn't mean we give up. There needs to be money for these older kids. I would call my older son a $1 million child. He has been in the system from day one, and he's not going to go out of the system till the day he dies. So it's not that we're going to give up or stop helping, but it does need to be sooner, a lot sooner.